The human heart is an incredible organ, working tirelessly to pump blood throughout our bodies. Inside this vital organ, 4 valves ensure blood flows in the right direction. One of these crucial valves is the mitral valve, situated between the left atrium, the collecting chamber, and the left ventricle, the pumping chamber. Think of the mitral valve as a one-way gate. When the left atrium fills with oxygen-rich blood from the lungs, the mitral valve opens, allowing blood to flow into the left ventricle. Once the left ventricle is full, the mitral valve closes tightly, preventing blood from flowing backward as the ventricle contracts, pushing the blood out to the rest of the body. This coordinated opening and closing of the mitral valve are essential for efficient blood circulation. However, like any other part of the body, the mitral valve can encounter problems. These problems can disrupt the normal flow of blood through the heart, leading to a range of symptoms and potentially serious complications. These conditions are collectively known as mitral valve diseases. Mitral valve prolapse, or MVP, is a common condition affecting the mitral valve. In MVP, the valve leaflets, which are supposed to close tightly, bulge or prolapse back into the left atrium when the heart contracts. This can sometimes cause a small amount of blood to leak back into the atrium. The exact causes of MVP are not fully understood, but it is believed that genetics play a role. Some people are born with a predisposition to MVP due to the structure of their heart valves. Other potential contributing factors include connective tissue disorders. Many people with MVP experience no symptoms and may not even know they have the condition. However, some individuals may develop symptoms such as heart palpitations, a feeling of fluttering or pounding in the chest, shortness of breath, fatigue, chest pain, and dizziness. Mitral stenosis is a less common but more serious mitral valve disease characterized by the narrowing of the mitral valve opening. This narrowing obstructs blood flow from the left atrium to the left ventricle, forcing the heart to work harder to compensate. The most frequent cause of mitral stenosis is rheumatic fever, an inflammatory disease that can damage heart valves. Other less common causes include calcium buildup on the valve, congenital heart defects, and radiation therapy. As the condition progresses, individuals with mitral stenosis may experience shortness of breath, especially during exertion, fatigue, heart palpitations, swelling in the legs and feet, and a persistent cough. Section 4. Mitral regurgitation, the leaky valve. Mitral regurgitation occurs when the mitral valve does not close completely, allowing blood to leak back into the left atrium when the left ventricle contracts. This backward flow of blood, known as regurgitation, can overload the heart and reduce its efficiency in pumping blood to the body. Several factors can contribute to mitral regurgitation, including mitral valve prolapse, rheumatic heart disease, infections affecting the heart valves such as endocarditis, coronary artery disease, and heart attack. In some cases, the exact cause may remain unknown. Symptoms of mitral regurgitation can vary depending on the severity of the leak. Some individuals may experience no symptoms initially, while others may develop shortness of breath, fatigue, heart palpitations, a heart murmur, which is an unusual sound heard during a heartbeat, and swelling in the legs and feet. Section 5. Advancements in mitral valve treatment, a beacon of hope. The good news is that significant advancements have been made in the treatment of mitral valve diseases. Treatment options depend on the specific condition, its severity, and the presence of symptoms. Lifestyle modifications such as maintaining a healthy weight, regular exercise, and a balanced diet can help manage symptoms and slow disease progression. Medications can be prescribed to manage symptoms like heart palpitations, high blood pressure, and fluid retention. In some cases, minimally invasive procedures, such as balloon valvuloplasty, which uses a balloon to widen a narrowed valve, or mitral valve repair, repairing the damaged valve, can be performed. For more severe cases, mitral valve replacement surgery, where the damaged valve is replaced with an artificial valve, may be necessary. The field of cardiac surgery continues to evolve, with less invasive techniques and improved valve replacement options emerging. These advancements offer new hope for individuals with mitral valve diseases, improving their quality of life and long-term outcomes.